So hello and welcome. Today our topic is rheumatic diseases, or second name for this disease is collagenoses. Uh, and it's really actual problem in nowadays because there are a lot of cases of rheumatism and rheumatic diseases in our clinical practice today. And you should understand the difference between rheumatism and another type of rheumatic diseases. We will discuss the difference of them today. Rheumatic diseases, it's a group of disease which associated with progressive disorganization of connective tissue and vessels. And one of the most characteristics of this disease are infectional immunological etiology. Uh, it's associated not only with some special infections or some um, factors of environment, but also with autoimmune reaction, and it's very important for understanding. There are a lot of risk factors for its development, like hereditary factor, infections, hypothermia, and using of drugs. Hereditary, sometimes or more of cases of rheumatic diseases are hereditary. Some cases of them may be associated with infectional diseases like streptococcus, and rheumatic diseases may be outcomes of in some infections. And we will discuss some infections today and their clinical forms. Hypothermia may be activation factor for development of these diseases. And also sometimes we use some special methods of treatment which will associate it with damage of connective tissue. All of these diseases are included in one group because they have some typical manifestations, like prevalence of chronic focus of infections, and most of all it will be associated with some special streptococcal infections, violation of immunological homeostasis, and this spot of manifestation associated with autoimmune reaction. And in all cases of rheumatic disease, we may see some autoimmune disorders. Uh, and one of the typical manifestation of this disease is generalized vasculitis. The damage of vessels, of small vessels, are typical for all of these diseases. Chronic wave-like course is typical clinical picture for all these diseases, and we may see some light periods and some periods of rising of injury and rising of disease for all diseases from this group, and all of them associated with systemic progressive disorganization of connective tissue. And I hope you remember something from our previous class about systemic progressive disorganization of connective tissue, because we start discuss this problem in topic about stromal vascular protein degeneration. And today we will review our knowledge about stromal vascular protein degenerations and add some new steps of degeneration. So, as I talked that rheumatic diseases, it's a group of diseases, we should discuss some nosological forms of this group. First of them is rheumatism, and rheumatism is one of the most important disease. There are a lot of cases of rheumatism in population in nowadays, and this disease most of all involved in the process heart and blood vessels. And you should understand that the heart and blood vessels will be injury at first, and all clinical manifestation of rheumatism and all complication of this disease will be associated firstly with this damage of heart and blood vessels. Second disease is rheumatoid arthritis, and rheumatoid arthritis is really actual problem in nowadays because it will damage joints in your patient, and typical localization in small joints in arms and legs, and that's why this disease will lead to some social outcomes, complications, because these patients couldn't or were not able to do some usual things like drinking coffee or make breakfast for themselves and so on. It's really dramatically situation, and which this is a huge problem in nowadays. The third disease is systemic lupus erythematosus, and I hope you know about lupus something, and most your knowledge associated with special erythema and damage of skin. In the face, we may see special erythema, which looks like butterfly, and you should understand that the most pathological and the most problematically injury is involved of kidneys in the process, and the all clinical symptoms and life dangerous conditions will be associated with kidney injury, and you should understand that systemic lupus erythematosus associated with kidneys first of all. And some rarely diseases like scleroderma, which associated with damage of connective tissue of skin, nodular periarthritis, which associated with damage of small arteries and wall of them, uh, and also bacterial disease, which associated with damage of spine, column, and articles or joints in the spine, and also dermatomyositis. And dermatomyositis also associated with damage of skin. All of these diseases from fourth due to seventh are very important too, but in our clinic practice we may see it very rare. First three are more important. So let's discuss rheumatism. Rheumatism, or disease of Sokolsky-Bouyer, it's a chronic infectious and allergic nature disease with progressive disorganization of connective tissue and blood vessels. You should understand that there are a lot of different forms of rheumatism, but all of them, first of all, associated with damage of heart and blood vessels. Etiology of rheumatism is beta hemolytic streptococcus, and I hope you remember about this microorganism from your microbiological department, that this microorganism has special antigens on their surface, and these antigens has cross autoimmune reaction with antigens on our connective tissue and on our skin, over our vessels, antigens, and so on. That's why our organism try to protect himself from streptococcus, but it lead to injury of our internal organs and our own tissues. Pathogenesis of rheumatism associated with some stages or steps of development. First step is sensibilization of body as a result of secondary injury and genetic factors. Result of secondary injury is second time of infections, and rheumatism manifested itself in case of second contact with streptococcus. It's impossible to development of rheumatism in first contact, in the type of first contact. Proteolytic effect of streptococcal enzymes on the connective tissue of the human body with the formation of outer antigens. So we should remember that streptococcus has special enzymes which may damage or injure our own tissues, and like a result of this injury will be formation of special inflammatory reaction in the place of adhesion, of streptococcal adhesion. Development of autoimmune response with formation autoantibodies, and I have already told you about autoantibodies. It's disorders of our immune regulation. Adhesion of immune complexes in the structures like basal membranes of vessels or column of cardiomyocytes and so on, and it may be just fibrils of connective tissue, it's maybe collagenous fibrins, and adhesion of complexes will lead to accumulation of glycosaminoglycans, firstly in the place of this pathological process, and it will lead to edema and development of degeneration in this area. And after that, we may see steps of systemic disorganization of connective tissue. So, from our previous classes, you know that systemic disorganization of connective tissue include mucoid swelling, fibrinoid swelling, and hyalinosis. So, on this class, we will add some new steps of this pathological process. Uh, First step is same, is mucoid swelling. It's superficial disorganization of connective tissue without destruction of collagen, and the special macroscopical manifestation of this process is reaction of metachromasia with toluidine blue. So, and few words about mechanism of phenomenon of metachromasia and developments of mucoid swelling. As you remember, mucoid swelling associated with accumulation of glycosaminoglycans in some area, and this accumulation will lead to increase of vascular permeability and lead to local edema. That's why we may see homogenization of connective tissue structures, and uh, with in reaction of toluidine blue with glycosaminoglycans, we may see phenomenon of metachromasia. And macroscopically, we couldn't find any changes here. And and one important thing about this stage, it's only one stage that could be reversible and reversible with any complications. So even in cases when we start treatment or patient start treat himself in this stage, we couldn't find any really deep morphological problems in this stage. Second stage is stage of fibrinoid changes. And fibrinoid changes include not only fibrinoid swelling but also fibrinoid necrosis. So, I hope you remember something about fibrinoid swelling. It's deep disorganization of connective tissue with formation of some special complex protein fibrinoid, and it couldn't be reversed. It's irreversible process, but it is degeneration. And also we should include in this process fibrinoid necrosis. And you remember about fibrinoid necrosis. Necrosis is some special example of death. It's local death or cellular death, which are typical for tissues which collect a lot of proteins, and fibrinoid necrosis typical for some muscle tissues, for vessels, and so on. So, and this information is same like we discussed it in our previous class. The third stage associated with some special cellular reactions. And in this cellular reaction, we may see formation of non-specific granuloma of Ashov-Talalayev. These two authors who first described this granuloma and this morphological formation. And in stage of formation of granuloma, we may see three stages. But previously, before we start talking about stages of formation of granuloma, we should revise what is granuloma. Granuloma is a formation or accumulation of cells which are able for phagocytosis. And for formation of granuloma, it's a special manifestation of productive type of inflammation and special type of inflammation with formation of granulomas. I hope you remember it from our previous class. And in cellular reactions, we may see three steps. All of these steps you may see on this slide. First step is step of blooming granuloma, and blooming granuloma associated with activation of process or secondary reactivation of a process. And in this period, we may see accumulation a lot of macrophages around of area fibrinoid necrosis. So it will looks like flower, and we may see some semi-transparent without any structures center of fibrinoid necrosis, and around it we may see a lot of macrophages, and macrophages has special morphological manifestation. They are big cells with very hyper colored nuclei, so that's why it looks like flower, and we can see we can give the name blooming granuloma because it looks like blooming of flowers. And after that, in some several days, we may see written granuloma. We may see a decrease of macrophages count or number, and accumulation of fibroblasts. Fibroblasts are small cells, and they looks like light blue, small rounded cells, and we couldn't find any flowers here, and we called this stage written granuloma. And after that, we may see formation of connective tissue fibrils in the place of granuloma localization. And the third stage is stage of sclerosing granuloma, and we may see large number of fibroblasts in pathological area and young connective tissue fibrils here. So, and development of this process will lead to fourth step of degeneration of connective tissue to stage of sclerosis. So, I have already told you that rheumatism is difficult or complex disease which can collect some special clinical-anatomical forms. And you should understand that all of these forms will be associated with injury of heart and blood vessels, but in some forms we may see damage of some other special organs. But first of all, one of the typical form of rheumatism is cardiovascular form, and it characterized only damage of the heart and blood vessels. In this form, we may see complications which will be associated only with heart damage. We may see cardiac defects here. We may see some endocarditis, myocarditis, and so on and so on and so on. We will discuss it a bit later, but you should understand that we couldn't find um, pathological process or disorganization of connective tissue, something in our place. But it will localize only in the heart. Yeah, I think it's clear. The second form is polyarthritic form of rheumatism, and it characterized by additional damage of joints. And we also may see some damage in the heart and blood vessels, but the predominant clinical picture will be associated with damage of joints. We may see pain syndrome in big joints like knee or other big joints, and it will be leading symptom of this form. The third form is cerebral form, and we may see damage of brain and little chorea in this form. And also we should discuss nodular form, which is associated with a formation of special pathological substances on the skin or in the skin, and it will be looks like nodules, and it will be some special nodular form of rheumatism. So let's talk about all of them closer. First of all, we should discuss cardiovascular form, and I already told you that uh, it manifested itself by vasculitis, endocarditis, and a lot of uh, other uh, other pathological processes like vasculitis, which is associated with damage of vessels, endocarditis, damage of internal layer of the heart, myocarditis, which associated with damage of the myocardium muscles cells, pericarditis, which is associated with damage of external layer of the heart, and rheumacarditis. It's a combination of endocarditis and myocarditis. And also, in some difficult cases, we may see pancreatitis. It's damage of all layers of the heart. Endocarditis associated with manifestation of rheumatism with exclusively damage of endocardium, of internal layer of the heart. I hope you remember normal anatomy from our previous class. We have already discussed it in our previous class. It's it associated with damage of endocardium and epithelial cells. Classification of endocarditis. There are different ways of its classification, which are associated with uh, parietal, caudal, valvular. It's according to localization, and according to morphology, it may be diffuse valvulitis, acute varicose, fibroblastic, recurrent varicose, and outcomes of these damages may be associated with cardiac defects and associated with some pathological process in the valves of heart. And it's diffuse valvular endocarditis, characterized by a diffuse lesion of the valves without a damage of endothelium. Acute varicose type of endocarditis associated with same changes. The difference is more pronounced febrile swelling and several reactions. And also we may see damage to endothelium in walls with the formation of small blood clots. And the formation of blood clots is a special manifestation of this stage, and it will lead to some special outcomes like embolism and formation of endocardiac thrombus and so on. These changes are located along the closing edge of the flaps in the form of warts of gray or red color. Fibroblastic type of uh, endocarditis occurs as a consequence of two previous forms of endocarditis while connective tissue grows in the wall of the valves. Sclerosing, scarring, deformation and thickening of the valve leaf and deformation of the cardiac defects in the end of this stage. Fibroblastic type of endocarditis associated with overgrowing of connective tissue fibrils in the valve, and it will lead to blockage of functional activity of valves. So that's why we may see formation of cardiac defect here. And recurrent varicose, it's a typical or special type of endocarditis which is associated with secondary injury of valve and repeated rheumatic attack, and it's more typical thrombotic overlayers occur on the already changed valve. And recurrent varicose type of endocarditis will have more complications. Obligate condition for formation endocarditis is a damage of the endothelium of endocardium. So you should revise our previous class, and I have already told you which any damage of endothelium will be associated with thrombotic complications, with vascular permeability damage, and so on and so on and so on. So all of these pathological manifestation of a process will be typical for this type of endocarditis too. Outcome of acute and recurrent varicose endocarditis. They are associated with overgrowing of connective tissue in the valve, in heart valve, and we may see formation of thrombus on its surface. And formation of thrombus may be complicated with autolysis of thrombotic masses, and it's a favorable course of this pathological process. Organization of thrombus masses will be closer to favorable because it will never lead to formation of embols, and pathological process will be localized only in the heart and will be associated with formation of cardiac defects. So it's closer to favorable, but not okay. And the last one is clot separation and circulation of its particles in the bloodstream, or formation of thromboembolia. This is one of the most dangerous complications of this type of endocarditis because it will be associated with damage in some other organs. It may be associated with blockage of arteries in brain, blockage of arteries or veins uh, in the lungs, and it will be have very difficult complications here. On this slide, we may see heart valves, and we may see healthy valve in the center of the slide. It's semi-transparent and very thick, and two valves which are nearby. We are we are involved in the pathological process because on this valve we may see fibroplastic transformation. It becomes very white. It will have white color, and it will be not semi-transparent. So the valve lose their elastic function, and it may be a reason for heart failure. On this slide, we may see acute verrucous endocarditis here, and we may see some formation of or overgrowing of some connective tissue in the valve, and it will be a really dangerous situation because it may lead to formation of thromb masses here, and after that we may see a lot of complications, and also formation of this overgrowing will lead to blockage of functional activity of this valve, and we may see sometimes cardiac failure here. On this slide, we may see fibroplastic type of endocarditis. It has special red-gray color here, and sometimes it may be complicated by thrombus masses, and you may see it here. And it also associated with blockage of valve in this area. On this slide, we may see recurrent verrucous endocarditis. It means that on these wells we have already had pathological process, and sometimes we may see formation of new pathological formation here, and it will be reactivation of a process or start of a pathological process in the already changed well. So this form of endocarditis may be also complicated by formation of thrombus and embolism. Histologically, we may see thromb here, overgrowing of connective tissue, and involved of endothelium in the pathological process. I have already told you that in complication or in the outcomes of endocarditis, we may see cardiac defects. So we will talk about them a few words. Cardiac defect may be classified according to origin to acquired and immediate, and acquired associated with some problems in process of formation of heart, and initiate may be associated with several types of pathological process. First of them is rheumatism, but also we may see formation of cardiac defects in case of sepsis or a lot of other pathological processes which will be localized in the heart. According to morphology, it may be stenosis of valve, insufficiency of valve, and sometimes it may be combined type of cardiac defects. According to prevalence, they may be isolated and combined. On this slide, we may see manifestation of stenosis of mitral valve. Here we may see decrease of lumen of the between the valves and overgrowing of connective tissue. So it will be stenosis, depress of the lumen of valve. In this slide, we may see problems with tricuspid valve, and we may see overgrowing here, and really difficult to say which type of cardiac defect was here, but probably it will be associated with stenosis again, because this overgrowing will grow into the lumen of the valve and will lead to blockage of them. On this slide, we may see some surgical methods of treatment with cardiac defects, which may be associated with some formation of some new valves, and it may be prothesis of valves. And prothesis may be also from animals, like in this slide we may see special valves, and more often we use valves from pigs and all our animals which antigen structures are closer to ours. So, second type of pathological process which typical for rheumatism is myocarditis. And according to classification, myocarditis may be productive and exudative. Productive type of myocarditis may be granulomatous with formation of Ashofter-like granulome, and we have already discussed it. And interstitial and exudative type of myocarditis may be diffuse and focal. But in the outcomes of all these processes, we may see cardiosclerosis or formation of connective tissue in the heart. On this slide, we may see productive inflammatory reaction in this localization and in this localization, and in the next slide we will see closer all pathological cells here. There are a lot of macrophages, and probably it's stage of blooming granuloma, because there are a lot of big cells like macrophages here. On this slide, we may see interstitial inflammation, and we may see accumulation of inflammatory infiltrate between cardiomuscle cells here. And same process. On this slide, we may see diffuse inflammatory reaction. In this slide, we may see focal inflammatory reaction with small area of damage here. Second or third type of injury in case of rheumatism is pericarditis. Pericarditis is damage of external valve of the heart, and according to morphology it may be cirrhosis, fibrinose, and fibrinose. And fibrinose, it's more dangerous type of this inflammatory reaction, because it associated with formation of fibrinose exudation in the cavity of pericardium, and it may lead to formation of connective tissue overgrowth in the pericardium cavity with formation of the panzer heart or armed heart. On this slide, we may see accumulation of semi-transparent fluid in the pericardium cavity, and the type of this inflammatory fluid tell us that most of all it's a serious type of exudate, and if patient still alive, it will never lead to any complications. But in this case, patient dead, and it may be associated with a lot of other problems in these cases. So on this slide, we may see fibrinous type of exudate and the formation of special fibrils in the surface of the heart. We may see these light or white lines here and here and here, and it's typical for fibrin transformation and formation of fibrin in the surface of the heart. On this slide, we may see overgrowing of connective tissue and fibrin fibrils between myocardium and pericardium, and it's starting to of formation of Panzer heart. And it's really difficult complication because in case of this of development of these complications, we may see depress of the heart, decrease of its muscular function, and some problems with blood flow in the whole organism, and it may be associated with chronic formation of chronic heart failure. Histologically, we may see wall of the heart, its myocardium, and in the surface of myocardium, in the external surface of myocardium, we may see formation of fibrinoid fibrils here, fibrin fibrils here. Outcomes of the cardiovascular form are associated with formation of chronic heart failure, thromboembolic complications with the development of circulatory disorders, chronic heart failure associated with myocarditis, and sometimes pericarditis, which is associated with blockage of muscular activity of the heart, thromboembolic complications associated most of all with localization of pathological process in the endocardium and formation of thrombus firstly, and after that transformation of thrombus into embols. And causes of death in case of rheumatic disease is decompensation of cardiac activity, formation of edemas, formation of hypoxia, and formation of edema of vital necessary organs, and death of the patient. Pneumonia, which is associated with pulmonary edema, cerebral hemorrhages, which may be associated with thromboembolic complications of endocarditis, and intercurrent diseases, which may be complicated by rheumatism. Second form of rheumatism is polyarthritic form, and I have already told you that this form of rheumatism are characterized by damage of heart, vessels, and joints. And this type of rheumatism occur only in 10% of patients, affect mainly large joints like knee. The nature of the exudate is inflammation is cirrhosis without the development of damage of the articular cartilage and consistory changing of the localization of injury. So sometimes it may localize in the left knee, and pain syndrome will be saved in this localization in few days, but in few days it will migrate to right knee, and so on and so on. It will never can see constant localization. Nodular form of rheumatism more often manifested itself in the childhood and associated with disorganization with formation of nodes, fibrinoid necrosis with inflammatory by lymphocytes and macrophages accumulation along the tendons, and the clinically development of a supravascular ring-shaped erythema. On other organs, we may see similar changes but without clinical manifestation. So it may be involved some internal organs with formation of of fibrinoid necrosis and infiltration of lymphocytes, but we can never see clinical manifestation of the process. Patient will never feel it. And outcomes of this form is formation of fibrosis in the place of pathological process. On this slide, we may see fibrinoid necrosis center and accumulation of inflammatory cells in the round. The cerebral form of rheumatism occurs in self or manifested itself in childhood and manifested itself by minor chorea. Uh, Pathologically, it's associated with vasculitis, degenerations, changes in the cells of brain, and small area of ischemia and necrosis and hemorrhages in the brain. And we can never see changes in the other organs, or in other organs we may see minimal damage. So it was first disease from rheumatic diseases. We have discussed rheumatism. The second one is rheumatoid arthritis. Rheumatoid arthritis is special type of rheumatic disease which associated with previously or predominant damage of joints, and it's more common in women and children and mainly affects small joints of arms and legs. And I have already told you that this type of disease will be associated with really big social problems, social activity problems. This patient not able for cooking, for dressing, for drinking, and a lot of other usual type of um, of manipulations. Uh, this self manifested itself by proliferative inflammation with development in the cartilage and formation of the rice bodies and formation of panus and panus is special morphological formation which is associated with overgrowing of connective tissue or granulation tissue in the cartilage, and this granulation tissue will be damage of cartilage structure, and it will lead to some pain syndrome to lead to damage of cartilage. The formation of fibro-osseous ankylosis are typical to it's some special type of formation of connective tissue with blockage of motion activity in the joints, and we can see also the rheumatoid factors in the peripheral blood. Please turn off the microphone. I ask you twice. On this slide, we may see overgrowing in the joints cavity, and we may see rupture of these formations and formation of rice bodies here. Microscopically, we may see changes like that, and they are associated with formation of overgrowing of connective tissue here, and it will lead to blockage of motional activity here, and may be associated with some huge problems with motional activity, and it will lead to some macroscopical manifestation of a process. Macroscopically, rheumatoid arthritis will be looks like that, and we may see damage of small joints here and deformation of joints, and you should understand that some usual things are impossible for these patients, and it's associated with dramatically change of joints. Now we discussed two pathological approaches in case of rheumatic diseases which are associated with damage of cartilage and damage of joints. We are rheumatoid arthritis and polyarthritic form of rheumatism. And in your clinical practice, you should differentiate these pathological processes. So, they have different inflammation, localization, damage of cartilage, and character of damage. In case of polyarthritic form of rheumatism, we may see exudative inflammation in the big joints without damage of cartilage, and it will change its localization, its variable character of damage. In case of rheumatoid arthritis, we may see productive inflammation, which will be localized in the small joints, will be associated with damage of cartilage, and will localized in the place where it starts. Systemic lupus erythematosus is diffuse connective tissue disease characterized by systemic immunocomplex injury of connective tissue and some other forms of anatomical formation with damage of the vessels of the microcirculatory system. And I should to tell you again that the most important pathological process in the systemic lupus erythematosus is associated with damage of kidney's function. Manifestation of lupus associated with kidney damage and formation of special lupus nephritis. Lupus nephritis associated with immunocomplex reaction and accumulation of complex in the glomeruli and its basal membrane and formation of hyaline thrombus in the glomerular capsule and formation of the exudate. And microscopically it looks like wire loops. I will show you on next slides. In the blood we may see LEA cells. It's special macrophages and special transformed macrophages, and we may find special antibodies to DNA and RNA here. On this slide we may see the most important manifestation of lupus, damage of glomeruli. Damage of glomeruli associated with damage of basal membrane of vessels in it. It associated with large that basal membrane is large in size, increase in size, and it accumulates a lot of homogeneous proteins like hyaline, and looks like wire loops here, 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 and here. And all of these processes will lead to damage of the most important filtrative function of the kidney. On the ultraviolet examination with special methods of staining, we may see rheumatoid factors here. We may see special antibodies like that here. So, and it's all for today. Thank you for your attention and goodbye.